High-dose internal radiation offers the best chances of cure for aggressive prostate cancer or for a tumor in an advanced stage. Learn how the HDR afterloading therapy works in this video. My name is Dr. Stephan Neubauer. I am a specialist in urology and urological surgery at the West German Prostate Center here at the clinic at the Ring in Cologne. More than 60,000 men in Germany are diagnosed with prostate cancer each and every year. Fortunately, in the majority of these cases, the disease is still confined to the prostate and no metastases have formed. But in some of these patients, the tumor is particularly aggressive or locally more advanced. These are referred to as intermediate or high-risk prostate carcinomas. For these patients, numerous studies have shown that the most effective and at the same time gentlest treatment is a combination of external radiation and high-dose so-called brachytherapy. This is a special form of so-called internal radiation. The chances of cure are significantly higher in most cases compared to radical surgery, and this comes with significantly fewer side effects. In HDR afterloading therapy, a high-dose radiation source is temporarily inserted into the prostate, and the tumor is irradiated directly on site. In contrast to seed implantation, the radiation source does not remain permanently in the prostate, but only for a few seconds. The procedure is based on remote-controlled afterloading of the radiation source into fine puncture needles that have been previously inserted through the perineum. Detailed ultrasound layer images are needed to create the radiation plan, such as for precise targeting. With the help of a special computer program, a 3D model of the prostate is created, and the dose distribution and the required loading of the individual needles with the iridium source are calculated. The tiny radiation source can move to any position of the needle in millimeter increments and emit its radiation over a defined period. Through precise distribution of the radiation, the prostate can be irradiated with an extremely high dose without damaging surrounding structures such as the bladder, intestine, or sphincter. Depending on the severity and aggressiveness of the tumor, the HDR afterloading therapy is performed multiple times, usually at weekly intervals and under short anesthesia. Just like with a seed implantation, the patient can usually leave the clinic the next day. HDR afterloading therapy is usually combined with a low dose of external radiation. This allows the surrounding areas around the prostate, where tumor cells may have already breached the capsule, to be treated as well. This also applies to the adjacent risk structures, such as the seminal vesicles or the lymph nodes. The combined afterloading therapy is therefore particularly effective for prostate cancer patients with a medium and higher risk of organ-exceeding growth. According to a recent study published in the renowned journal JAMA, the mortality rate for patients treated with brachytherapy in combination with external radiation therapy was only 3% after 5 years, compared to 13% after external radiation alone or 12% after surgery. The risk of developing metastases was also lowest in patients who received combined radiation therapy. Another major advantage of the afterloading procedure is that it leads to excellent cure rates without significantly or sustainably impairing the patient's quality of life. Involuntary urine loss, also known as urinary incontinence, occurs in less than 2% of men. Limitations in potency are also significantly less common and less severe compared to the surgical removal of the prostate. The patient is also not taken out of his private environment or professional life, and does not have to undergo any rehabilitation measures. In 2001, at the West German Prostate Center, we were able to confirm the long-term effectiveness of HDR afterloading therapy in combination with external radiation and its advantages due to the low side effects based on our own patient data. Since the year 2000, we have performed more than 9,000 brachytherapies on patients with medium and high risk. After that, we follow up with the patients. For over 20 years, we have known how the patients have fared and what results the therapy has brought. If you would like to learn more about HDR afterloading, brachytherapy in general, or prostate cancer, simply schedule an appointment with us here at the West German Prostate Center in the clinic at the Ring in Cologne. We look forward to seeing you.